I'd like to ask you a little bit about sealants, Dr. Diez. Are the sealants needed for the first type of the baby teeth or for the second set? Should adults also have them? And when are they needed? There's lots of talk about it, and I'm not so sure we all understand the ramifications of it.
Well, everybody has different opinion on it, so I'm going to give you my opinion.
That's what we want, nothing but your opinion.
What we believe in, what we like to do, and I'll present the logic to it, is as far as sealing the baby teeth, I really leave that up to the parents. If I see a child with a high decay rate, in other words, the first time they come in, there's just decay all over the place, I'm going to recommend that they seal the baby teeth. Most of the time, though, especially when the parents are bringing the children in early, the baby teeth don't have a real high decay rate. And I would say we rarely put sealants on baby teeth. Okay? Now, that being said, as soon as the permanent teeth, the teeth that erupt and that the child is going to have into adulthood, preferably, hopefully the rest of his life, her life, I recommend sealing. When those teeth come up, the grooves on the top of the teeth, the parents, you can look in your child's mouth and see them. You see the little lines at the top of the teeth. Well, they are so fine that no matter how much you brush, even just one single bristle of a brush a lot of times cannot fit into that groove. So the bacteria tends to harbor there. If we can catch that tooth the minute, and I say the minute, that's an exaggeration, within a month or two of it erupting, coming out of the gum, then we know bacteria hasn't had a chance to invade these little grooves. We can clean them out, and we definitely recommend sealing that tooth. Now, I do have some concerns when a permanent tooth on a child, let's say it's been up in the child's mouth and functioning for a year or two. I do have some concerns about sealing a tooth like that, because sometimes with our instruments, okay, it is impossible to be 100% sure that there's either no decay or there is decay present in a tooth. I will say in my office, we do have laser technology where there's a special type of laser that reads the tooth and will determine if it has decay, and it's higher than 90% accuracy. But, again, my concern is, and I see it happen way too many times, is where a tooth is sealed. Okay, the tooth has been up for a year or two, and a dentist seals the tooth with all good intentions, but they did not realize that there
already was a cavity in it.
That's right.
Or maybe not a cavity, but something, some of that bacteria which makes the cavity happen. There it is, not like almost like an unhatched cockroach kind of stuff.
There you go. And what the danger in it is, then the dentist can no longer check that tooth because the sealant has that groove where the cavity was starting covered up, so you can't check it anymore. And those cavities can get very deep. So I think it's really critical, okay, to seal permanent teeth. But that being said, I think the tooth should be sealed relatively soon after it erupts into the mouth, after it comes up out of the gum.
Got it. Very, that's information I've never heard before, and it's extremely, which is why we should go to a dentist. I guess he knows what he's doing, and shouldn't self-diagnose, especially in the direction of, I guess I don't need it. So, absolutely wonderful information. So now, such a seal, if a person has a seal, a sealant on it, more or less how long does it last? 2-3 years more, or what's the deal there?
A lot of it depends on how well the sealant's done. If it's done properly, I actually have, I've been practicing for 25 years now. I actually have adults that were kids in my practice at one time, and the sealants are still there.
Wow.
I would say the average is probably 5 to 7 years.
Okay.
A lot of it depends on eating habits. What we found is sticky candy really adheres to the sealant, and a lot of times then we'll pull it or lift it off.
Mm-hmm.
But I'll tell you something else that we've discovered, and our laser has kind of backed this up, the laser that we use to detect cavities. A lot of times, even though the sealant is not visible to the naked eye, or even when I have my surgical loops on, there's still sealant material microscopically into the groove, and it's still working. So we think that's kind of neat.
That's kind of neat. Well, that's wonderful.
They last a long time.
Yeah, and I guess your question, your answer before, or your alert, which you put out there, that once a tooth is out too long and putting a sealant on could possibly have the fact that you encapture a cavity already. That, I think, answers the question that once a person has the sealant on it, you really probably don't put it on again. No really need to, right? Once it comes off.
Occasionally, you'll have a sealant come off right away.
Right, in that case.
On a very young child, yeah, if it comes off 6-12 months, then yeah, we'll reapply it. But that's not a real common occurrence.
Right, but on an average, such as say the sealant wears off, it comes off like 4 or 5 years later, and 7 years later the guy there's no reason to put it on anymore because it would again have the danger on it and no more real reason, right?
That's right. That's right. And the other thing to remember too is at an early age, it is much more common to get cavities on the biting surface of the tooth, on the top of the tooth, the part that you and me can see very easily with the naked eye. As we get older, okay, it's less common to get cavities there, and it's more common to get them in between the teeth.
I see.
So once we get a child into adulthood with sealants or cavity-free, it's much less likely they're going to get cavities in the area the sealants seal.
Okay. Well, that's a lot of information about just sealants alone, but very informative. Thanks a lot, Dr. Diez.